Hi, I'm Dr. Manmeet Ahluwalia. I'm a medical oncologist. I serve as the chair of medical oncology, chief scientific officer, and the deputy director of the Miami Cancer Institute in South Florida. And I'm really thrilled about the poster that we are presenting today, the work that we have done with our colleagues at a number of marquee institutions in the United States. So, as I said, I'm at Miami Cancer Institute. We collaborated with the doctors at University of Maryland. We had physicians at Mayo Clinic. We had Miami Neurosciences Institute, Sunnybrook in Toronto, which has been one of the leaders in the field of focused ultrasound, New York University, and then there was support provided by Insight Tech, which is a company that actually has a device which is a MR guided focused ultrasound to non-invasively disrupt the blood-brain barrier. So the title basically of this trial is a prospective multicenter trial of focused ultrasound for blood-brain barrier disruption for liquid biopsies in patients in glioblastoma called the LIBERATE study. And what we are doing is with these really remarkable institutions, we are trying to scale a challenge that we see in clinic every day. And basically, as you know, liquid biopsy has transformed outcomes of patients in cancer, particularly lung cancer. But in brain tumors, one of the challenges that we have with liquid biopsy is because of this presence of the blood brain barrier, we do not have enough circulating cell free DNA. And basically, what we do in liquid biopsy is we look at cell free DNA and we try to see whether can we use that as a diagnostic tool and then a prognostic tool and then as a longitudinal tool. And in brain, we have that challenge. But what we have now is this modality described as the MR guided low intensity focused ultrasound, which can non invasively disrupt the blood brain barrier treatments to enrich the circulating plasma cell biomarkers. So, what is MR guided focused ultrasound? Basically, we take a patient into the MR suite, and then the patient is in the machine, just like someone undergoing an MR. And then we apply the focused ultrasound, and it non invasively disrupts the blood brain barrier from anywhere from 4 hours to 24 hours. And essentially, what we are doing in this trial is we are getting their blood right before we are doing the procedure, and then we are collecting blood and 1 hour later, and 2 hours, and 3 hours later. And essentially, this is a prospective multi-center self-controlled pivotal trial, and we're calling it a pivotal trial because our arrangement with the FDA is if the trial is successful, this could lead to an approval. And the inclusion is patients over 18 years who have suspected or recurrent glioblastoma who will be undergoing a biopsy or resection. And we are looking at 15 North American centers in total. Exclusion is patients with multifocal tumors or tumors arising from midline thalamus, cerebellum, or brainstem. And essentially, patients are administered intravenous microbubble oscillators with the Definity platform, and then they undergo MR-guided blood-brain barrier opening with this particular device, which is a 220 kilohertz low-intensity frequency ultrasound device, which is made by this company called Insight Tech, the X-Blade Model 4000 Type 2, with real-time acoustic closed-loop power control. And essentially, as I said, we are doing pre and post procedure phlebotomies to see what's the yield of the cell-free DNA right before the procedure, then 30 minutes later, 1 hour, 2 hours, and 3 hours. And then these patients will then undergo surgery, and then we will collect that tissue to see what's the alterations in genomics and transcriptomics. And so the primary endpoint of the study is defined per patient as an agreement rate between the cell-free DNA derived and the tumor tissue derived biomarker patterns. And the primary hypothesis is that if there's a 70% agreement with the biomarker patterns in what we see in the blood, post-LIFO, and the tumor tissue samples, then we are doing something which is in the right direction. Secondary hypothesis is, can the disruption of the blood-brain barrier with LIFO cause a twofold or a greater increase in blood cell-free DNA? And the trial is powered to evaluate both primary and secondary hypotheses. And basically, we are looking at one-sided alpha of 0.25 with a 90% power. And so we needed 50 patients to do that. We have a number of exciting exploratory endpoints, which is looking at sensitivity of detection of known somatic mutations in cell-free DNA with blood samples collected before and after LIFO, and then looking at the estimation of cell-free DNA levels, as I said before, 30 minutes, 1 hour, 2 hours, and 3 hours to look at the time of the greatest yield. Why I'm really excited about this trial is that in brain tumors, our ability to uh, promote or push drug development is that we cannot know in real time what's driving someone's tumor. As we use lung cancer as a poster child for drug development, there's a lot of liquid biopsy used in those patients. And in brain tumors, because of the blood-brain barrier, we are not seeing enough circulating cell-free DNA to identify what are the targets we can go after. So we're very excited if this trial is successful, it could transform how we look at patients with brain tumors, and they could undergo a non-invasive procedure that can be done in an outpatient in a couple of hours, and we can collect their blood, and within 10 to 12 days, we would have a report of what is the new marker of resistance, so we can look at targeted therapies to design the next cadre of trials or next drugs that we treat to treat these patients. Thank you so much for your attention.